Around the block, queues for a walk-in COVID test in Bury, Greater Manchester, an area already on alerts after a surge in numbers.
I did try and book the drive-through, because I've been told there's a drive-through available locally, but when you go on the website, you've not a chance.
I tried all afternoon yesterday because I drove round Bury yesterday as well to get a test done, but I couldn't get one.
Some people had come back after failing to be tested yesterday, waiting 3 or 4 hours in the hot sunshine. From Bury to Westminster and more examples from across the country and across the political divide.
I have had 2 Farnham residents sent to Bristol for their tests.
My disabled constituent Ian Kenny has been trying since the 8th of September to get a home test.
My constituent in Barnsley has been trying for 7 days to get a test for her teenage son after he was sent home from school with a temperature.
I've heard from parents, teachers, a vicar in Luton North all saying there are no walk-in tests, no drive-through tests, no home kits available when they need it.
And I'm afraid I have to tell the Secretary of State that testing is not at a record high in my constituency.
Listening to the case, I'll of course be happy to look into it. If the Honourable Lady gets in contact with me with that individual case, well, I'll happily look at that individual case.
After a while, the Health Secretary seemed almost as overwhelmed as the testing system itself. He was in the House of Commons in the first place to answer an urgent question.
Mr. Speaker, we are at a perilous moment. Imperial College estimates the virus is doubling every 7 to 8 days. We all want to avoid further restrictions or another national lockdown. But when testing breaks down, contact tracing breaks down, and the growth of the virus cannot be tracked. The Prime Minister promised us whack-a-mole, but instead his mallet is broken. The Secretary of State is losing control of this virus. He needs to fix testing now.
Yeah. Secretary of State. Well, Mr. Speaker, the good news in responding to that is that capacity for testing is at a record high.
Mr. Hancock did admit eventually that there were operational issues and that it would take weeks to sort it out. The focus is on the Lighthouse Labs, the network set up to process COVID-19 tests and run by Deloitte. Repeated questions about what the constraints are have not been answered. But this academic, who helped set up one of the first of the Lighthouse Labs, says he does not believe it is staffing.
The vast majority of Lighthouse Lab staff now are on proper short-term contracts. They are working full-time for the Lighthouse Labs. There are still some people leaving the Lighthouse Labs to come back, but not at a level that would cause their ability to test to crash. That's just not the case.
And do you believe it has crashed?
I don't think the Lighthouse Labs have crashed, no. The Lighthouse Labs, in my understanding, again, chatting to colleagues, is that the Lighthouse Labs are still performing 30,000 tests a day. They are absolutely working flat out, maxed out, performing all the tests they can. I'm very confident that it's not the actual labs as such, it's somewhere else in the process.
Wherever the pinch point is, there are growing examples of teachers and pupils being sent home and NHS staff not able to go to work. The Scarborough GP at home with her son while they try and get a test.
I tried putting in postcodes a little bit further away from home because I didn't mind travelling a little distance, but still absolutely nothing yesterday. I started trying again this morning at 6:30, and again there's just been nothing available. Finally this morning there was a couple of tests available in Blackburn, which is a 5-hour 250-mile-hour round trip, which just isn't possible. I just think it's so important really that the government acts quickly to give priority testing for health and social care staff, because otherwise, you know, our basic services are going to be struggling.
The government plans to once again highlight those who should be prioritised for testing: patients in hospital, care home residents and those with COVID-19 symptoms, and health and care staff. If they can, of course, find a testing site. Well, a tough day for the Health Secretary there, but I suppose you could say that if a government describes its testing system as world-beating, you are raising expectations, and that is going to make people cross when those expectations aren't met. Now, it's very hard to believe that winter is coming on this incredibly beautiful day, but the government, of course, needs the data from those testing sites to be able to look at those infections rising and to be able to look at
things like whether there needs to be a lockdown, which they absolutely want to avoid. And I've been told today they also want to avoid having to shield people again. But if they do have to shield people, they have much better data, I'm told, a much better methodology to be able to avoid a blanket shielding as they did earlier in the year. So children, for instance, who we know are not as susceptible as or vulnerable would not have to be included. And they're hoping that even that if it does have to happen, and I have to emphasise they don't want it to, that they can be more targeted.
Victoria McDonald. Well, now, as we just heard in Bury, people needing coronavirus tests faced lengthy queues today and hours of waiting. Demand for tests is rising in the area, and in Bolton, the number of cases is rising despite another lockdown being imposed. Our North of England correspondent, Claire Fallon, is there for us tonight. Claire.
But John, this is the area with the highest infection rate in the country, and that is this area's latest testing centre. It only opened today, and you might take that as being evidence that areas with higher rates of infection are being prioritised for testing. It's not that straightforward, though, because along with the other testing sites in Bolton, this place has actually been pretty quiet during the day, while at the same time people who live in this area who've been trying to get tests have been going on to the centralised booking system have been told that there are no tests available. This evening we've heard from the local hospital that people are now turning up there at the A&E department asking for COVID tests, and this is at the same time as that same hospital is telling us that they have now seen an increase in the number of people who are seriously ill with COVID-19 who need hospital treatment. Little wonder then that there is some frustration in this area. And earlier on, I spoke to the leader of the local council, a Tory leader of the local council, and he told me that the testing system is failing Bolton.
Unfortunately, the reality is that many of our local residents who are trying to access tests cannot. And that is leading to a lot of resentment, a lot of frustration. We were asked to find extra sites, and now we're between a rock and a hard place. We've produced the sites are up and running, but nobody can access them.
Because what we've been hearing from ministers literally today when they've been asked about problems with testing is that in the areas with the highest infection rates, testing isn't a problem, and that's why people in some other places are struggling to get tests, because that test capacity has essentially been moved to places like Bolton.
Well, the test capacity is there. It has been moved. We have opened it. We have increased the test capacity, but it's just not being accessed because of the ability to actually action those tests. That is my understanding. We have done what we were asked. We provided those sites. We've got them up and running. That's been publicised, those sites. People can only access those sites via appointment on the national portal. And that national portal is currently failing our residents.
Strong words there, and I've been given this evening the latest data for the infection rate in Bolton. It does look to still be going up, almost at 200 cases per 100,000. To put that into context, that is 4 times the level when an area is declared as being a red zone for COVID-19.
Claire Fallon. Well, now 9 out of 10 children were back in classrooms in England last week, according to official attendance figures published today. The first since the autumn term began. That's 5% below average. But teachers are now warning that attendances could fall because of chaos in the testing system. Our Home Affairs correspondent, Darshana Soni, has been speaking to head teachers.
Enjoying the sunshine today, they've been back at school for 3 weeks now at this primary in Loughborough. At first, attendance was high, but since then it slid right down. Amber had been glad to send her daughter Phoebe back, feeling she'd missed out on her education during lockdown. But last week, all of her children had to miss another 5 days because they couldn't get a COVID test.
We tried to order a test on a Tuesday, but we couldn't get one, trying from about 6:30 in the morning. And then on Wednesday at 6:30, we finally managed to get one, and that came on the Thursday. Did a test and sent it off. We didn't get the results. So I rang on Sunday and they had to tell me over the phone because it was just like too long. It took too long to give us the results.
In the end, all of the family were negative.
Fabulous. So what two adjectives are used to describe a volcano?
But if cases do erupt, there's a fear that the delays in testing could be hugely disruptive. The school has 316 pupils, including 60 with special needs. The head teacher is determined to keep providing all of them with an education, but she currently has 8 staff off waiting for a test.
Some staff have been very quick at getting tested and getting back to school. Other families have found it very difficult. They've either been asked to drive more than an hour, or they've had to wait several days, or they've had to wait several days for results.
What's been the impact on you as a school when you have staff and families waiting for the tests?
It is difficult having staff absent. Staff, our aim is not to bring anyone extra into the school, so we've had to work across the school. That's leaders, other staff taking greater responsibilities, but we managed it.
The first official attendance figures for all schools in England have been released today. The Department for Education says that around 92% of all state schools have fully reopened, and that around 88% of all children have gone back for the start of the autumn term. But we've been contacted by head teachers across the country who say those attendance figures are in jeopardy because the problem of accessing tests is causing chaos in schools.
At this secondary in Kingston upon Thames, 70 children and a number of staff are currently off, waiting to be tested. Some have been told they can't get an appointment because they have no symptoms. Others have been offered a test 5.5 hours away in Carlisle.
I can't express my frustration and anger enough that the government have not stepped up and kept their part of the bargain. They knew months and months and months ago that if the schools were going to stay open, if it really was going to be a priority, then we had to have an effective testing system.
The Department for Education says from tomorrow every school will be able to order more home testing kits. These attendance figures are encouraging, but teachers warn that the real danger lurks in the winter when cases could spike. Darshna Soni, Channel 4 News, Loughborough.
Well, earlier I spoke to Dr. Adam Kushasky, who is an epidemiologist from the London School of Hygiene and Tropical Medicine. I began by asking if he thought the government was being over-optimistic over its ambitions on test and tracing, given the current setbacks.
I think we do need to be more innovative and ambitious in our testing. Test and trace can make a difference, but that alone isn't sufficient to stop transmission. One of the reasons is by the time you get a case that shows up symptomatic, they probably already infected others. Those people themselves are becoming infectious. So having scaled up testing, particularly in risky environments, care homes, healthcare, maybe workplaces, can help you get ahead of those outbreaks. But saying that, test and trace is a really effective measure. It can make a difference, and currently it's not working effectively enough. We've got these tools that we know can make a difference, so we need them to work effectively and also develop these more ambitious approaches to testing alongside.
The government have said it's going to take weeks to get this track and tracing process back on track. What does that mean, therefore, for the outbreak itself?
I think we're seeing quite a few troubling signs in terms of our understanding of the current outbreak. Obviously, delays in testing make it much harder to understand where transmission is happening. But really, during outbreaks, we have this cycle between understanding and control. If we can understand where the outbreak is, we can be much more targeted in our control measures. As soon as that outbreak understanding declines, we end up having to rely on these increasingly blanket measures. And that's what happened back in the spring.
So it's inevitable, really, that the outbreak will spread and indeed deepen.
I think a lot of what happens next depends not only on what the test and trace system does, but also in terms of behaviour change. It's not the case that test and trace alone is going to be able to solve this. If you look internationally at South Korea, New Zealand, Hong Kong, other measures have been required. In an ideal world, those targeted test and trace measures will make a big difference. At the moment, they're probably making a much smaller difference, which means that it's going to be about behaviour change. It's going to be about people getting on board with these measures to reduce the risk that's going to slow this down and enable, hopefully, a scale up of test and trace to start to pick up the difference as soon as possible. I'm
just wondering whether you feel that perhaps the medics in particular should have a higher role in determining how this track and testing is done.
I think really we want the approach to be as fast and efficient as possible. I think we have seen a transition to more local engagement, which I think is important. Obviously, if a flare-up's occurring in a local area, it's going to be the local response that has an ability to get on top of that. So I think we need that local efficiency and speed. But I think we also do need that integration with the national picture, because we want to be able to deploy resources as effectively as possible.
Do you think we were too quick to get children back to school? I mean, is that perhaps the key element that has swollen the numbers?
I think it's very hard to say exactly what was increasing transmission, because we obviously had a lot of measures being relaxed, and across Europe, gatherings and other events have restarted. But I do think children need to go back to school. And if we're thinking of this idea of a budget of transmission that we can afford to kind of create risk, if we're creating risk by getting schools back, we have to think about how we can subsidise that by reducing things in other areas. And it may be that we actually have some tough choices to make, especially with universities potentially going back, working out what we have to use to offset the risk that we're creating with education.
Adam Kushasky, thank you very much indeed for talking to us.
Thank you.
Well, now joining us now is Helen StokesLampard, the chair of the Academy of Medical Royal Colleges. That's the body which represents the UK and Ireland's 24 medical royal colleges. Thanks very much for joining us, Helen StokesLampard. I'm wondering what your reaction was to hearing the Health Secretary warn today in the Commons that it would take weeks to sort out the track and test issue.
Well, it's desperately frustrating as a frontline healthcare professional myself, but also for all those I represent. We need testing up and running as quickly and effectively as possible. We have an NHS to run, we have acutely unwell people to treat and to look after, but we also have the whole of society to think about, a society that is safe, where the vulnerable know they are being looked after, and where those who are at risk and want to be out at work and being productive members of society can get the testing they need. But I'm not surprised that it could take a few weeks to fix the situation that we're in. I think there's no doubt that the surge in demand has taken everyone by surprise. I mean, ironically, we've got a remarkable testing system already in place. We've got one of the highest numbers of test centres and test facilities anywhere in Europe, and with over 220,000 people a day are being tested, but clearly it's not enough. So it's a bit ironic that we're in this place now when so much effort has gone in. So I don't want to pay credit to those who've worked very hard, but clearly there's more that we've got to do, and very quickly, to get this back on track.
Well, of course, you have an extraordinary spread of medical input from your 24 colleges. And I'm wondering, I mean, given that we've now had 6 months of an attempt to get this going, can you tell from what they're telling you what's gone wrong?
Well, as you say, it's the whole breadth of medicine is feeling this in different ways. I mean, at the very acute level, we've got a huge number of doctors who are saying, I can't function effectively because colleagues are off at home because they or family members are unable to get tested. So the commonest lament this week has been younger children with what we would normally have shrugged off as mild viral self-limiting illnesses that create a fever or create a cough, meaning that children quite rightly need to be tested, and therefore their immediate family contacts are having to stay at home until this is sorted. So there's the logistical, how can we run the NHS when we've got a lot of members of staff? That's not just doctors, that's right through the staff and in education, as we've already heard. But the good news is...
Sorry to interrupt, but then what is the effect, therefore, on patients?
Well, in my own practice, or this week, I'm a general practitioner. In my own practice, I have 3 colleagues on Monday could not be in work because they had to be at home because they were shielding awaiting testing that they'd been trying to get for a couple of days. And so the inevitable, I mean, what actually happened was that the rest of us just shouldered more work and they did what they could remotely. And so hopefully patients didn't feel too much, and that will be replicated right across the system. But you've got a system that's already stretched, people are tired. And if you put additional pressure now, which is, in a sense, not clinically driven, but is system driven, that's unhelpful when people are anxious about the winter. And I think we need to be clear that the winter is going to be tough. It's not going to be a normal winter.
Let's stand back for a moment. What are you telling families to do? I mean, we've seen families in Bury and Northern England waiting for hours and hours for this. Is it better to go home and simply do nothing? What is the answer?
if you or a member of your family has a cough, a fever, or have lost your sense of taste and smell, you absolutely need to go through the process to get tested. The problem is it's a bit frustrating right now. Now, we have lots of assurances that it's going to be fixed in the coming weeks and days. My experience of friends and colleagues has been that it's taken up to a couple of days to get a slot in a reasonable distance from home. Some people have got through straight away and got it. But for some people, it has been tedious and frustrating. But please persist with it. Please stick with the rules. Do not give up on it. Do not go back to work because it's probably fine. Please stick.
It's easy to be sort of, knowledgeable after the event. Yeah. But what has caused this pinch point in September?
It seems to be, I said, I'm waiting to see the hard data myself, but it seems to be a surge in demand fueled by far more people asking for testing. And people, of course, had got used to the mantra over the summer, which was, if in doubt, get a test. And the mantra is not that. The mantra now is very clearly, if you are symptomatic, request a test. And so there's been a sort of subtle shift because over the summer there was huge spare capacity and we know testing centres were sitting empty and labs weren't that busy. We've had the surge, it's overwhelmed demand. So now let's be clear, if you need a test, you absolutely must request a test and please persevere. But if you don't need a test, if you don't fall into that criteria, but you just like to be on the safe side, please leave the space for those who really need it. We need to look after the very sick. We need to protect the vulnerable. And then we can allow everything else to function because it's desperately frustrating for us all.
That's really useful. Thank you very, very much indeed, Dr. Stokes-Lampard, for your advice. Thank you.
Pleasure.
The travel industry has suffered its worst summer season in living memory, and the aviation sector is on its knees with thousands of flights cancelled and workers facing redundancies. So far, the government has refused to back a scheme to test passengers when they arrive back home. However, Germany has found a way of unlocking the skies with mass testing at its major airports, protecting German jobs. We can speak now with Paul McNamara, our business and global trade correspondent, who's now in Frankfurt. Paul.
Yep, good evening from the beating heart of the German financial sector, where just behind me, a couple of hundred people are enjoying a meal at a restaurant looking very similar to how they might have done pre-coronavirus. Now, of course, not everything's returned to normal here. We spoke to Deutsche Bank yesterday, one of the biggest banks in the world, saying, can we come and film with you? They said, actually, a lot of staff are still at home. But in large part, workers have returned to the offices here, and bosses say one of the key reasons behind that has been testing, mass testing. So while people have been queuing for hours in the UK to get tests today, when I landed at Frankfurt Airport, I had a test. Within 6 hours, I had the results back. And remember, the UK is still not backing testing at airports, which the travel industry says is crippling them. Where this plane lands, the government is still hoping for a V-shaped economic recovery. Furloughed workers will be paid into next year, and they're testing for coronavirus en masse as travellers arrive. How many people are you testing every day?
In this test centre we're testing around about 4,000 people a day.
And how many can you test a day?
Up to 20,000.
Welcome to Germany. Land here from an at-risk country, and there's no 14-day quarantine, just a relatively quick swab. Has this helped you get back in the air?
I'm absolutely convinced that testing is one of the major and most important elements that we have to restart the travel business. It's the worst situation we can get. And testing is not perfect, but testing is the best way to take care of this without locking down everything.
Here in Frankfurt, on-site testing has been available since June. The scientists argue they're spotting 99% of people carrying coronavirus and are feeding back valuable information to data modelers.
Even when we declared that, for example, Spain is now a risk country, we could tell the people that we have tested all the returning passengers and the fraction of positives was low at the beginning. But then we could show that it was rising, so the incubation time and all that was really modeled in the data. And this gives us now confidence as well in close contact with authorities and with politicians that we take the right measures based upon the data we have.
60% of tests are returned within 12 hours. The aim, 100% within 24 hours.
And just say R.
Airline bosses say this isn't just helping the health of the nation, but the health of the economy. It may not look it, but this is now the busiest airport in Europe according to the latest numbers, which means that for the first time in more than a decade, Heathrow has been knocked off the top spot. Now that's not all down to testing and quarantining. But it's a big part, says Heathrow's boss. And what's at stake here is jobs. Lots and lots of jobs.
For security reasons, baggage...
Last month, Heathrow had less than a fifth of the passengers it had in August the previous year. Hoping to get people flying again, they built a testing facility, which right now stands empty. 10 days ago, the Prime Minister was asked why.
Everybody thinks you can have some test at the airport that will answer whether you've got it or not. Unfortunately, it only works in 7% of the cases.
It's not accuracy in science that's the issue, says the boss of Heathrow. It's something within the government's control.
It is the lack of capacity in the government's own testing labs that is holding us back from moving to testing for airport passengers. We can overcome that by using private labs to do this. I've been speaking with one of the biggest providers who says they can do that without taking away any capacity from the NHS or from care homes.
Nowhere has been untouched by coronavirus, but some are seeing greener shoots of recovery. Germany is one of them, buoyed by exports to China. Business leaders in Frankfurt say as many as 80% of office workers are back. Throw in Brexit too, and they have their eyes on Britain's businesses. But that combination then of coronavirus, of testing and Brexit on the horizon, are you hoping to capitalise on that?
Absolutely. We've seen that in the last couple of years that many companies try to set up their shop here in Frankfurt, in the area, of course because of the airport and because of Brexit, because they say, well, we need to have a foot on the ground in the EU.
Germany's lockdown was light and short. Its testing regime has been large scale and, crucially, its casualties low. There is no sign yet of the sun setting on this pandemic, but plenty of glimmers of a life Frankfurt used to know. Now, in the last few moments, we've had a response from the Department of Health to those claims you just heard by the Heathrow boss. A spokesperson said work is ongoing with clinicians, the devolved administrations, private testing providers and the travel industry to consider if and how testing could be used in future to reduce the self-isolation period. So watch this space.